from Center for Affordable Water and Sanitation. Can everyone hear me? Center for Affordable Water and Sanitation Technology. This is the study that we have initiated a few years ago, and then very recently we have a significant input from Cranfield University to expand our catalog to over 100 organizations. So I will present some of the results of this study. So COS, we are a new member of Susanna. We just joined this year, and I want to take 30 seconds to tell you who we are. So we are an NGO based in Calgary, in western part of Canada. We provide training and ongoing consulting support to government, community groups, and NGOs of all sizes. Our core expertise was in household water treatment, but recently we expanded into household sanitation, community health promotion, water quality testing, and a number of other things because of the demand from our clients. And in the last 11 years, we have held 400 different training workshops and attended by over 7,000 people. So the purpose of this study is to understand who are the capacity building organizations out there, what do they do, and where do they work. Because we are a capacity building organization, we want to know where we fit in this landscape, and also to identify potential gaps in the global capacity building landscape. And so the method is we have examined 72 different networks of WASH organization, and we found who are the organizations working in WASH. And for example, we went to CapNet and looked into their big networks of organization. And then we reviewed the different organizations from the information on their website, and then identified those that do capacity building, and we found over 200. And then we limit the study to those that do capacity building of other organizations, rather than those that do capacity building of the end users. And so that we narrowed that down to 104. And then we develop a catalog that has 5 sections. First section is on the basic information of the builder, and then their capacity building policy, their targets, what type of action they do, and how the capacity building effort is being monitored and evaluated. And based on this catalog, then we go back to the 104 organizations and trying to fill the information. And mostly our information comes from their websites, but we also send questionnaire to each of the organization, and then we did receive some reply. So for example, this is a catalog we have for this organization. First table there, you see that is the basic information on the organization, who they are, where are they based, how many staff, what is their budget, and so on. And then we look into the capacity building policy. I will explain a little bit more detail on what this means later. And then we look at the targets, who are they targeting, we look at the main action they do, we look at how they monitor and evaluate, and finally we have a reference of where the information comes from. So of the 104 capacity builders in our catalog, we found that more than half of them have headquartered in Europe. And that is a little bit surprising to us. Based in North America, we thought, North America has a lot of NGO, we do a lot of things, but actually we are not as much capacity building focused as our European counterparts. And by organization type, 60% are NGOs, and there's also significant contribution by private companies, research institutions, and other type of organization in doing capacity building. Then we look at the year of creation. Many of the capacity building organizations are created in the, started in around the 80s and 90s. And, but one note of caution here is that some organizations may have been established long ago, but only recently became active in capacity building. And it was difficult to us to find out exactly what day they started doing capacity building. So the day here is just the day when the organization began. And then we break that down into different into the countries and continents, and we found that in the earlier days, most of the capacity building organizations are based in Europe, and then North American ones are started in the early in the 70s, 80s, and then it was very nice to see that there's also increasing number of organizations based in the developing world. We look at the annual budget of them. 74% we couldn't find any information from the website, and those that have information, we see that most of them have a budget of between 1 million to 10 million British pound range. And again, it was difficult for us to really look into how much of the total budget of the organization devote to capacity building. So these are the overall total budget for the organization. We look at what approach they use, and bottom-up approach, that means training the client staff is the most popular. But there's also a lot of organizations doing a top-down approach, for example, changing the client's organization's policy. Some organizations, they do partnership approach, actually working together alongside with their clients. In terms of actions, training is by far the most popular. Training your clients on a certain technical subject or management subject is the most popular. Networking, providing resources, mentoring, consulting, these are also frequently mentioned. We look into the WASH topic, what they build up capacity on. Water and sanitation are the most popular, a little bit less on hygiene. And number of organizations, and then we look into the technologies and look into what type of technology they promote. So household water treatment and household sanitation both are pretty popular. Community water and community sanitation are less. And many organizations, they said just it depends on the situation. Whatever our clients needs, we will provide. And of this organization, we also look into what other topics they build a capacity on besides WASH. So you see a lot of organizations mention agriculture, development, economy, environment, health, and others. And then, so here shows that who are the targets of the capacity building effort. NGOs, CBOs, and public institutions such as local and national governments are the main targets. We look at how they charge the financial, their capacity building activities. 19% they do not charge at all. It's totally provided for free. 8% said not only we don't charge, we actually will even provide resources to you to implement a project. Example would be the World Bank. And then 9% say we will charge depending on the project. Like for example, at cost, we will, depending on who our client, our rate varies from 0 to full cost. And then 18% do full financial charging, and many we couldn't find information. And then we look into how these organizations monitor and evaluate their capacity building activities. And we found information from 39% that they do have some monitoring evaluation, and 61% we couldn't find anything. So in terms of summary and the gaps we discover, first, capacity builders are mostly European NGOs providing training on technical subjects. And we found that there seems to be some duplication of service in some area. For example, there are a number of organizations producing training material on the same topics. So we feel that perhaps better coordination, sharing of information may improve efficiency. And but we also found that there are few indigenous capacity builder, and we feel that more is needed because indigenous builder knows the local language, knows the local people well, they can provide better support. Capacity building activity concentrates in capital cities. We found that, and is lacking in the rural area and the more remote area, but those are the area where the local capacity is the weakest and requires the greatest need to build up the capacity. We found that few capacity building organizations, they provide full suite of service. Mostly that they will do one or two things, but few do everything. And capacity building is a long-term process, yet few builders, they build long-term relationship and provide long-term support to the clients. They deliver a training and then that's all, and then they never go back. They don't know how the clients are doing. So a few limitations of this study. First is that we were able to find most of our information from websites. So the builders that do not have website, we could not find information. It was difficult for us to find the information. Second is that website information are not necessarily up to date or comprehensive, so we may miss some information. We need more in-depth, maybe phone call, personal visit to able to get those information that we couldn't do. And different organizations use different terms. There are many organization gray area. Are they this or are they that? So it was sometimes difficult to categorize, and we try our best. So, so in conclusion, yes, I welcome all your suggestions and feedbacks on this study. And if you see that there's any mistake, error in the way we categorize the organization, I welcome your feedback. Please talk to me. Yeah, thank you very much.